Fat injections has been around for a long time. I remember when I was training as a plastic surgeon, we had patients who had a condition where they lost the fat in their face on one side. And there was various ways to reconstruct the defect, and we started performing fat injections. We were taking fat from one part of the body and injecting it into the depression or the defect in the face. And one got results. And then, so it was initially, fat injections were not used for cosmetic purposes. Well, since the 1980s, fat injections have become increasingly popular. To some degree, they've been surpassed by fillers because you don't need a procedure where you have to harness fat. But fat is remarkable in terms of what it can do to rejuvenate the face. So I do a lot of fat injections in my face. In fact, most of my facelift patients have fat injections together with the facelift, because you cannot build up the cheeks. You cannot efface some of the deep folds. So if one injects fat into the face at the same time as one having a surgical procedure, it's more practical maybe than to have filler injections. The trouble with fat injections, one might need 2 or 3 procedures in order to get the full effect. But by every time one does a fat injection, some of the fat survives, some collagen is built up, there's stem cells in the fat. All of this adds to rejuvenation of the skin. The appearance of the skin improves. There's slight increase in the volume in the cheeks. The beauty about how I do my fat injections is that all the fat's not going to survive that I inject into the face. Patients always worried they're going to look too puffy. If you do it in stages, you can build up gradually and one can stop before one gets puffy. So fat injections is probably the single best procedure one can perform in aesthetic medicine. And the reason being, once again, is that it creates volume. So as you age, you lose volume, you lose your fat, but it also improves the condition of the skin. So if one gets, from a young age even, starts getting fat injections, they can stave off the effects of aging. And this might be a way to stay young for a long period of time before the collagen of your face starts weakening, before your skin starts thinning and becoming crepey. I think still that fat injections are still in their infancy in terms of the effect that can be achieved with this procedure. It's unpredictable as to how much fat will survive. We have various techniques of doing fat injections, very controversial as to what the best technique is to create fat survival. But one can expect, especially after the second procedure, one will see an improvement. So the improvement once again will be some filling out of the face, some increased volume, improvement in the cheeks, improvement in the condition of the skin. So I tell my patients they may not see much improvement after one fat injection, but after 2 or 3, they will have a long-term improvement. And the results can be quite remarkable. So who is the best candidate for a fat injection? Well, anyone who's losing volume in their face. So anybody who is, even a young person might be an ideal candidate. An older person is an ideal candidate. So most people, anyone who's losing volume in their face, whose skin is thinning, becomes an ideal candidate for fat injection. So in terms of downtime, there might be some bruising and swelling, all of which should dissipate within a week. If once you're doing the injections, you have help to provide with you to provide compression and not to rush the procedure, one can limit the bruising and the swelling that occurs.